Hello, I'm Dr. Mira Irons, President and CEO of the College of Physicians of Philadelphia. Welcome to the latest in our series, College Conversations, Medicine, Science, and Society. Today I'm speaking with Dr. Matthew Wintersteen. Dr. Wintersteen is the Research Director of the Child and Adolescent Psychiatry Service and an Associate Professor at Thomas Jefferson University. He's been a college fellow since 2018 and is an advocate for suicide prevention and interventions. Welcome, Dr. Wintersteen.
Thank you. Appreciate being on.
Dr. Wintersteen, you specialize in suicide prevention and intervention for youth and young adults. Can you tell us a bit about how you came to work in that field?
Of course. A lot of people that get into the field of suicide prevention have had some personal experience with suicide themselves, whether it be somebody that they knew or other family members that have struggled in the past. And interestingly, that's not my story at all. I came to Philadelphia about 19 years ago as a postdoctoral fellow to work with Guy Diamond, who was at Children's Hospital of Philadelphia at the time. And we were doing an intervention around depressed youth. And applying for our next research grant, it became clear that the federal government was less interested in depression research and intervention studies anymore. And so we thought, well, how do we change this and turn this into something more meaningful and valuable? And we thought about, well, what if these youth actually had suicidal thoughts or engaged in suicidal behavior as well? And so we took this intervention and developed a study that was focused on the adaptation of it for suicidal youth. And that was the beginning of a very long story that has turned into almost 2 decades of suicide prevention work.
It's a wonderful story. And it reminds me, this is often how careers take off, right? You find an area that you're really interested in, and it just sort of becomes your life after a while.
Absolutely. I quickly became an expert in the area by default, sort of needed to do it. And we were starting to do suicide prevention work in primary care, which apparently at the time nobody was doing. And so you get to become a little bit of an expert in each area. So
that's right. So Pennsylvanians will be able to call 988, a new hotline, by July, a system similar to the 911 emergency call center, but focused on suicide prevention and mental health crises. You're part of a team working to launch the new 988 call number. What makes this program different from the current 1-800-273-TALK program?
Well, interestingly, it's not different at all. It's the exact same phone number. They've simply changed it so that beginning in July of 2022, all telephone services, all voice over internet programs, all of them will allow you to dial 988 to get the National Suicide Prevention Lifeline. So instead of having to dial the 10-digit 800 number, you can now call that 3-digit number. So the real difference is the phone number. The service is exactly the same. The call centers are exactly the same. It's just you simply have an easier, more recognizable number to remember to make that call.
Do you think that will increase the volume of calls that you'll get just because it's an easier number to remember?
Yes, I think that's probably going to happen. In fact, Vibrant Emotional Health, who is the administrator of the National Suicide Prevention Lifeline for the country, has put out projections for, first of all, the United States, but also each state. And so when we were looking at Pennsylvania, there's several different areas that they think may change in terms of call volume. So we have our typical folks that are calling the National Suicide Prevention Lifeline's 10-digit number right now. We think that volume may go up a little bit because, well, a 3-digit number is easier to remember. That's the first way in which we think some calls will change. The second is that every county in Pennsylvania currently has a 10-digit crisis number for that county already. The problem, of course, is unless that's a number that you call frequently, most people don't know that number off the top of their head. They would have to go searching on the internet or something to find it. And when you're in the middle of a crisis, having a simple 3-digit number like 988 to call is a lot more likely to happen than looking for that 10-digit number. So we think the call volume for those county-based numbers will actually start to decrease as calls to 988 will go up. And then the third area in which we think there'll be a change in call volume is around 911. We know there's many people right now who still call 911 if they have a behavioral health or psychiatric emergency. And we think that with the national marketing strategy for 988, which actually won't begin until the summer of 2023, when the national marketing strategy goes out, we think that some of the folks that are calling 911 for behavioral health emergencies will start to call 988 instead.
Okay. Just to confirm the dates, though, the marketing won't begin until the 2023, but is 988 going live in July of this year in Pennsylvania?
So according to the FCC, nationally, July 16th of 2022, 988 is live everywhere. The reality is that for about 95% of cell phone plans in this country, 988 is currently active as it stands right now.
Okay. Can you talk a little about the difference between the response to a call going to 911 and a call going to 988, just in terms of who's going to be responding and what services may actually, show up at the scene or wherever you are?
Sure. If you call 911, typically it's a system where there are protocols. So if you call that number, the responder is trying to determine what is it that you need and who needs to come to you.
Mhm.
And so they'll often decide, okay, well, this sounds like it's a behavioral health emergency. Or if you were to call 911 and say, I'm thinking about suicide, their response will be to activate law enforcement. And so they will then go through the local jurisdiction to the command center there, which will dispatch law enforcement to wherever it is that you happen to be to respond to that particular emergency. Calling 988, on the other hand, what happens there is those are trained counselors that are there to address behavioral health concerns, suicidal crises, et cetera. And they do this 24/7, 365 days out of the year, and do it all of the time. They don't simply figure out, do we need to send somebody out to you or not need to send somebody out to you? They will spend 15, 20, 30 minutes, an hour and a half sometimes for individuals just to make sure that they help to resolve that call over the phone. Now, if they can't resolve it over the phone and you truly do need somebody to come out to you, they can dispatch mobile crisis services to come out to you. Or if they're talking to you, they're concerned that you may be suicidal, you're talking about having a gun in your possession, for example, and the mobile team may be coming out, they might also dispatch law enforcement as well through the 911 system. And the reason for doing that is obviously the safety of the mobile team that's showing up at the home. So the main difference between the two, if you call, is one system is simply looking for who do I need to send to you, which more times than not is law enforcement. And in the 988 system, it's how can I help you? And we try to address these issues over the phone before sending anybody out. And what we know from data is through the National Suicide Prevention Lifeline, about 80% of the calls that come into the Lifeline actually get resolved over the phone and nobody needs to be dispatched to the home.
Mhm. Great. And so I guess that in the 988 system, if law enforcement is sent out to the home, there'll also be mental health professionals that'll be sent out at the same time, potentially, to deal with both aspects of the crisis.
That's the perfect system. And we're trying to figure out how to make this all work. And the reality is that the National Suicide Prevention Lifeline already coordinates with 911. So there's no differences there. We're trying to figure out how to do it more efficiently and more effectively because we want to have the right response for the right concern. And law enforcement responding to behavioral health concerns isn't always the right response for a lot of reasons. The most important reason is that law enforcement then is being pulled away from other areas in which their need exists. And the same is true for EMS and so on. So we want to make sure that people are showing up on scene that have the right resources and the tools to handle the issue, but are the right people to respond to it.
In medicine, we always say, the right care for the right patient at the right time.
Exactly.
And this is the same thing, is the right care for the right person at the right time.
Exactly.
We hear that the numbers of mental health emergencies are increasing and certainly have increased during the pandemic and continuing to go up. And there never seems to be enough mental health providers. Do you have concerns that with the call volume potentially going up, that there will be a shortage of mental health providers in some areas and the call centers will be overwhelmed?
Well, as you said, there's already a shortage of mental health providers in most areas of Pennsylvania. So this is not new news necessarily. I think the challenge for us is to figure out, how do we increase our capacity to respond to the calls such that if our 80% number stays the same, that 80% of the folks calling, even the new callers that are calling that number, get it resolved over the phone. So if you think about the transition of care from someone calling 911 to 988, if we see a shift in that, and we also see the potential for those to get resolved where somebody doesn't necessarily need to come out to the house. And so there's a chance that this can get resolved by using, the phone service as opposed to other mobile teams or other types of crisis stabilization services, et cetera. There's a reality, though, that, again, with a shortage of mental health providers statewide, it's quite possible that there's going to be some concerns about that. But our goal really is, to get people to the right places, to respond to the needs that they have and be there and be available for them. And so, while there may be a shift in this and it may result in more need for outpatient care, perhaps afterwards, we're already there as it stands.
Okay. You talked a little about suicide prevention and primary care. What messages would you give for practicing physicians, primary care providers, the healthcare team about what to tell patients about this new system?
Well, we think about somebody who may be suicidal, who's coming into the emergency room or coming into primary care or any other area of medicine for that matter. If we're concerned that they may at some point in time need crisis services, but not in the moment they're there with you, we often tell them, listen, call 911 or go to the nearest emergency room if you're in crisis. Well, those two systems as it stands right now result in usually people showing up in the emergency room. So if police show up at your home after calling 911 and they're not sure that you are safe enough to be left alone, they usually take you to one of two places. The first is jail. If you become agitated and irritable, you may end up in jail, which is not where you need to be. Or you might end up in the emergency department. And again, here you are boarded in an emergency department waiting for space. There may not be a bed for you. You may not even need a bed, but then you've been brought there only to be sent home. So there's a concern about that as the type of response that we have. What I would be telling all physicians these days and everyone in medicine is, calling the National Suicide Prevention Lifeline, calling 988 is actually an effective strategy to use because, again, they have the ability that if that person is in such a high level of concern, they can deploy mobile crisis teams, they can deploy law enforcement if needed, they'll get people to where they need to go. But again, more times than not, they're going to resolve the issue over the phone.
Great. So in December of last year, Joe Pyle, president of the Thomas Scattergood Behavioral Health Foundation, who's also working on the 988 launch, was quoted in the Inquirer noting that the city is not where we need to be for a July launch of the program. Now, obviously, December is, 5 months ago now, 6 months ago. How have things changed in the past few months? And does your team feel that we're more ready now?
The Department of Behavioral Health and Intellectual Disability Services in the city of Philadelphia is the group that's responsible for the local response to 988 and everything crisis related. That said, Joe and I have spoken in length about this in the past, and we've known each other for a while now. So, this is not new news. I think it was really designed to be a wake-up call, not necessarily for the city to do something more and greater than what they're doing already, but to understand that as the call volume goes up, we need more people sitting at the desks answering the phone calls. The city needs more mobile crisis teams because let's face it, there are people in crisis, and if there's a mobile team that's already deployed and there isn't one available for you, who's going to come out to the house? Well, it might be law enforcement in that particular case, or EMS or somebody like that. Again, not necessarily the right response for that person at the right time. So there is a need to build some more of these services behind it. Now, there's lots of different ways to do that. One approach is the federal government has issued various grants that the Office of Mental Health and Substance Abuse Services at Pennsylvania has applied for. It has won to help build up some of these services. And so we recently got funding from SAMHSA to increase the capacity at our 13 call centers that we have in Pennsylvania. So this is a great thing. The problem is it's 2 years of funding, and it really only accounts for about 5% of the total projected call volume when 988 hits its maximum capacity at some point down the road. So there's still a huge need for sustainable funding for this type of service, as well as increasing mobile services, as well as crisis stabilization. So there's a lot of things that need to be enhanced. They're there, particularly in Philadelphia, they're there. They just need more of these things. And so there was a National Suicide Hotline Designation Act that was passed in 2020. This act actually allows for states to propose legislation through their own general assemblies that would allow for a telecom fee. And so similar to what we have for 911 in Pennsylvania, for those of you that are unaware, every cell phone bill that you get, you're paying $1.65 every single month to cover 911 services. The proposal is to do something similar to that for 988 in Pennsylvania. In fact, most states are looking at these kinds of things, and you can imagine there's a lot of challenges and barriers with doing this. But one of the things that we're most excited about is taking the opportunity not just to increase our ability to answer calls, but there are many counties in Pennsylvania that do not have mobile crisis teams or enough teams, as we have the same issue here in Philadelphia. And so how do we build those things up? We create this telecom fee that allows us to have somebody to talk to. So that's the phone service, somebody to respond, that's the mobile services, and a place to go. So crisis respite and crisis stabilization services. So the goal is to create a telecom fee that we're hoping to push through the General Assembly fairly soon that will allow us to do that.
Okay. And I think I remember seeing in a newspaper report that the majority of people in Pennsylvania actually would support, a telecom fee.
We're hoping so. It's not the people that are necessarily voting for it. So we encourage you to get out there and talk to your state representatives.
Exactly, exactly. So just in terms of raising awareness, since the marketing isn't going to start until 2023, how do you think the college can assist in promoting this program, and not only just this program, but championing better mental health resources in our city?
Well, I think there's a reality, which is the national mass marketing for 988 isn't going to come out for over a year. I have no idea exactly what that's going to look like. I can assume then we're probably going to see things on television, on the radio, on the internet. There'll be a lot of things promoting 988. It was supposed to be this summer, but they're delaying it for a year. We think that's because they're giving us an opportunity to increase capacity nationwide to be able to answer more calls. And without the massive uptick in calls that we would expect to have once the national marketing strategy comes out, it gives us a little bit more time to build and grow. Now, our call centers, I think, are prepared. We've experienced upticks in the past. Logic created a song, 5-6 years ago, 1-800-273-8255, just happened to be the title of the song. It was the phone number for the National Suicide Prevention Lifeline. And guess what? More people called. When Robin Williams died by suicide, when Anthony Bourdain, when Kate Spade died by suicide, the media put the phone number for the Lifeline out there, and they increased an uptick in calls, and they were able to respond. So I think we're still there. I think the college can assist in the process of local advertisement, if you will, of the 988 service is not a terrible thing. We want to make sure that people are aware of the service. We want to make sure that people are able to utilize it. And again, most people can use it on their cell phones right now. If you're needing that type of service, it's available to you. And we can be telling people that now. We just don't want to go out with a mass media approach to it. The concern is, particularly in a city like Philadelphia, if you put this through the large media networks that we have in Philadelphia, there's going to be people outside of Philadelphia County, in fact, in New Jersey, in Delaware, that are also going to get that. And if they're not prepared for the uptick in calls, then they're going to get slammed a bit too.
Yeah, absolutely. So I always give the people I'm interviewing a chance to give any final thoughts. Are there any final thoughts or words that you'd like to remember from this interview?
I think the important thing for people to remember is that there are services available to you. It's easy to get concerned that there are not enough behavioral health providers out there in the community. I get that. That is something that everybody is working toward. But right now, if you are in a crisis, there is a number that you can call. They will help you. They will respond to your call. They will help you over the phone. And if you need more than that, they can help get you that too. And so this shift to 988 is nothing more than changing the phone number for that service, which again, there's probably going to be an increase in call volume. And so we want to use this opportunity to build more services out there broader, not just in Philadelphia, but for the rest of Pennsylvania as well. So we hope that people will continue to use that. And we hope that they'll use it when they need it. There's truly help available. So please call.
Great. So Dr. Wintersteen, thank you so much for taking the time to talk today. And thanks to all of you for listening. We'll be back again with another episode of College Conversations, Medicine, Science, and Society soon.